So you're just going to have to face it. Our face, literally, goes out into the world and has to interface, has to be a buffer guest, has to hold in our reaction mode sometimes, has to negotiate, hold in flinches, bite our tongue, all these things that happens to all of us. So it deserves a little bit of care. So I'm just going to go through a couple steps that I do for muscle trigger points in the face and a lymphatic support, and also some gua sha to all the places that could use a little bit of help, especially as we age, right? So what I typically start doing is I use a little bit of oil. This one I got from my friend Leah, who's basically the horse's mouth on the source of evolved skincare. So I just start with a little bit, put it on my skin, inhale, and then you're going to start with just gentle, actually quite vigorous in a way. Your fingertips are going to be a little stiff, and you're not going to slide the whole time. You're going to grip so that the fascia, the underlying part of the scalp, is going to get gliding back and forth. We have a lot of nerve endings back in here that supply the face and scalp. The lymphatics are right under the surface, and if this isn't moving throughout the day and doesn't get stimulation, you're going to get some sluggishness. So you're going to go behind the ears, and I'm going to go a little bit. You're going to keep going at this speed, but I'm guessing that you're picking up a lot of scratching noise. So back of the head, right where the skull meets the neck, behind the ears. Eustachian tubes, ringing of the ears, the facial nerve, the trigeminal nerve, limbic system that wants us to bite things, and then the top part of the face that does more of the genuine smiling. Irish eyes are smiling, top of the face, we're all good. Bottom part of the face, I'm gonna bite you. So ironing down those, finding some spots there. You're not looking to hurt yourself, but you'll find some spots right there. Take some time, breathing. Trigger points of the jaw, the masseter, really important muscle for neck pain, headaches, clenching at night, breathing. Then you're going to go up under your eyebrow, and you're going to just glide through there and find some tender points. Mine's not too bad today, but often I have one right here. So if you find one, just stay there. I do have it, it just was hiding. Stay there for a few breaths. Then you can come down under the zygoma, and usually you can find one right here, scooping under that bone. Right there, breathing. So that one on me actually hurts a little bit more than it should. So I'm not going to push very hard, and don't be mean to your body. When you find a spot, make an offering and wait for the body to consent to that pressure. If you're bullying, then that's on you. So one here, and then often there's one under here, which does these nice muscle trigger point, wrinkly, yucky face right here. Right there. So find it and breathe. Not spending too much time on these trigger points. Just a few breaths, and maybe just one under here, one here, and through the masseter. And then go back to your just sort of scalp fascia gliding all to the back of the head, to the sides especially. And when you're going to the sides, consider softening your jaw and opening up the back of that neck, right where the head meets the neck. Relax your jaw, elongate the back of your neck, and looking to sort of scrub or erase down into those bones. Feel like your finger bones are touching your skull and moving all the lymph through there. Moving on from there, my friend Leah, that's also the horse's mouth on what best oils there are, would probably also find some gloves that aren't made of oil spills. So Leah, if you can comment where we can get better lymph gloves, that'd be great. From here, same thing, just stimulating your face with the lymph. My 5-year-old daughter actually loves this to the back for her back at night. Also helps show your kids and your face and your skin where the edge is. So just spending a few minutes, not hard. The lymph is right under the skin, so you're not looking to push hard on the lymph. I started with the trigger points because then you're going back at your face with gentle strokes, just with this. And then pulling out gua sha. I like this shape. And what you're going to do with that, see my face is red. I know my face was red before, but it's now even more red. You're just going to go toward the lymphatics in the face, go out this way, and then heads down the neck, so under the collarbone. So you're looking to just encourage all of that fluid. And I like these because they're cold. In the summer, I'm going to try putting them in the fridge. Breathing, relaxing your chest, going across. I'm just going to do my right side first. Just a few passes. Do the left side, under the eye toward exit route. If you wanted to, and I often do right now, I feel that going over my masseter. You can use it to get this, rake this. You'll hear like little crunchy spots under there. I just did a little ADD, went from muscle interface to gentle, ask the body to send that fluid out of your face. So facial nerve, trigeminal neuralgia, just go a little at a time. You might be better off doing a little bit of dry brushing, but if you're in charge of it and control of it, if you just get some safe information going through the skin, some safe information of the face. Neck, you can kind of slack this tissue a little bit while you rake down. Tiny, tiny and not hard to get that lymph under the jawline. Going down toward this way and down, rake behind the neck and down. So good to do on your kids if they have ear infections. It's good to do for yourself, just to face the world. Same thing on this side, get that neck going. And also working with the social engagement system of the face and the vagus. Polyvagal theory, Stephen Porges talks a lot about our face and our voice being the interface of safety negotiation. So all of this matters. Sinuses, clearing out the sinuses. Yeah. Good. So to review, face needs some attention, lots of interface with the world, nervous system regulation, lots of trigger points, lots of flinching we do in our face. And then, so circulation, lymph drainage, trigger points. I recommend just some little gloves, some high quality oil to get into your tissue while you're doing this, because it's a perfect opportunity to do your beauty routine. Cream doesn't work as well as oil, in my opinion, especially as I'm getting older. And then I like this kit that I found online. It has 3 different shape stones, so you can go based on what works for you. Can go back here and rake through those muscles back here that tend to clench. Yeah. Take care of your face.